I'm back. So really thinking about this topic within the realm of community health nursing and public health nursing, when you think about an emergency response, like let's go back to my example with the fire, the family who suffered the fire. That is a disaster. It's a disaster in the American Red Cross's eyes, and obviously, for that family. Just the same way that a tornado would be affect more people in a larger area, that's a disaster as well. So now when I think about emergency communication and emergency response and thinking about how it specifically impacts an individual family has been really interesting to have that opportunity to take the time to figure that out and to work through that, so narrowing it down to the actual family. So when you think about the military family, and I know that I'll be able to go into more detail and in greater depth when I actually submit my paper, but just understanding that it's a very complicated issue, very complex, and I really wanted to look at it, as a critical care nurse, and look at it in disaster response nursing or emergency response nursing, or just as a public health nurse. But really, it took starting to look at it with a holistic approach because of all the implications and things to consider when you're working with a military family. So you've got the military member and you've got their family. So, they can be overseas in the family here, in the United States, or the entire family could be overseas and they have family members back here in the United States. And then each individual family, it could be a couple, there's still a family and there's still people that we have to consider. And you also have, an entire family, maybe school-age children. So the possibilities are endless, and the situation is very complex and complicated. So I've actually learned a lot and gained from working through, all the different implications for these families and the military members. Um, okay, so when we talk about services to armed forces and emergency communication and the on-call medical liaison role, um, it's important to understand that there are a lot of community services available to military members just outside their door. And when I say outside their door, I'm meaning outside of the military area. So even though the military supports them with the military hospital, um, the VA hospital, if the patient is retired or is unable to return to active duty, you've got the VA hospital, but there are hospitals in the community serving them, and then lots of community organizations that are available and ready to mobilize for these patients as well. So I'm saying too much, so apologize for that now too, but I'm going to keep going. Okay, so when to kind of summarize, when I was reading there, I came across a resource that was put out by the National Military Family Association, and it talked about finding ground. That was the name of the article. And finding ground is actually a toolkit that's put out for community agencies that support the military members and families. And when you think of larger organizations, pause now. Okay, so when you think of military organizations, think of volunteer organizations or just even large companies or corporations. Lots of times they will have money set aside or resources set aside or services set aside specific to military members and their families. So kind of part of what I've been working on is pulling all that information together so that we know that when emergency communication services, contacts a military member in the time of emergency, that they have access to all these resources and understand what all their options are. Okay, and I'm going to see if I can get that. I really can't get my graphic in, so I'm just going to have to talk you through it, and I feel confident that I can do that. So talking through the graphic here, the graphic actually has injury, illness, and death, because these are the most common reasons for a emergency communication to occur. It's usually due to an injury, illness, or death. And the point that I want to make while we're looking at all three of these things is really to understand that this goes both ways. This isn't just an injured military member overseas. This could be a child who's suffered some type of traumatic injury back in the States, and now the mom is having to deal with that. Or illness. It's not just the military member coming down with something. It could be the family. Let's say the mom is the primary caregiver at home, and she's been diagnosed with cancer. So the military member needs to be notified, because is this mother going to be able to take care of the children or the responsibilities that she was handling here back at home. And then death. It may not just be that the service member was killed in the line of duty. It could be that they've lost one of their parents while they're serving their country overseas. So just understanding that it goes both ways. So I'll touch on that here now that we have this time together. And I am getting paranoid about the time, but I'm going to keep going. Okay, so looking at injury and illness specifics, the things to consider are the military resources and the community resources. So I spent a lot of time looking at, looking and understanding what the military has available for the military members and their families, and then understanding what the community resources are for the military members and their families. And my intention is to put together, I'm working on developing a flow chart, something to just make sure, very simple, so at the time of the emergency communication, that this maybe a website or a piece of paper, a document, can be turned over to the family or the military member as a resource, because we know what it's like, when we're told that something devastating has happened. We're not going to be ready to hear about all these options that are available for us. But what I'm working on doing is figuring out a way to incorporate, a holistic nursing approach and the processes that are already in place within the American Red Cross to accomplish that goal. And all that's coming up now is death. So death is the other one. And I think it's important to know and to say that I am looking at mental health issues, taking those things into consideration. And I really do feel like I should start to wrap this up, because I'm going over my time. And I do apologize for the videos being choppy. Thank you for your time. I appreciate it.